who is also a veterinarian. Christine, can you go ahead and present yourself, introduce yourself?
Yeah, for sure. Well, thanks, Jeremy, for staying up so late to chat with me about glucosamine. Also, this time, for those of you joining and who maybe joined the previous webinar we did, we actually put together a little presentation just because we're going to get a little bit technical talking about studies. And so we felt it was appropriate to have some visual support. And so, as Jeremy said, my name is Christine. I am a French veterinarian, and I graduated from the vet school of Toulouse. So we also have a great little slide to show my face with Chichi, who's my Frenchie bulldog, who's in France right now. And so, as I was saying, I graduated from the vet school of Toulouse in France, but I also was lucky enough to go to Cornell in the US and a few other schools, including, North Carolina State, University of Ohio, and also Louisiana. Once I graduated, I actually worked as a practicing vet for a year, basically. And then I also have been working in the pharmaceutical industry. And then I joined a group of veterinary practices. And now, onto a new adventure with Jope. So it's a pleasure being here today, and, look forward to answering some question on glucosamine.
Thanks, Christine. So maybe let's start by a simple question. What is glucosamine and how does it work?
Yeah, so, this is where this presentation is going to come in handy because we're going to get a little bit technical. And so glucosamine, you probably hear the word quite a bit, especially if you're a dog parent and you're trying to find the right solution for your dog when it comes to helping their joints. And so glucosamine is one of the most popular supplements on the market. What is it? So it's actually a sugar that is naturally present in the body of dogs and of humans, and it's especially present in the joints. You can also find it, interestingly, in shellfish. I always struggle with this word, so bear with me. But basically, on the shell of the shellfish, you're going to have glucosamine, which is generally in supplements where they actually extract the glucosamine from. What's also important to note is that there's 3 different types of glucosamine. There's a glucosamine hydrochloride, which is most often used in dogs. There's also glucosamine sulfate, which is actually the one we use in human most often. And in the glucosamine sulfate category, there's actually a specific type of glucosamine that is used mostly in Europe. And that is the main one used in Europe for joint pain or arthritis in humans. And then there's a third one, which is actually not used in the form of supplement, which is called N-acetyl glucosamine. So it is important to note that there's 3 different forms. And the reason it's important is because they're not actually as bioavailable. And so what does that mean? Jeremy, stop me if I'm going too fast. No, but basically, what it means is that these 3 different types of glucosamine are not going to be absorbed the same way by the body. And a lot of studies that have been done on glucosamine actually showed that it's the glucosamine sulfate that is usually more bioavailable. But it also means that it's more expensive. And so, unfortunately, and we'll see that later, and if you have, a glucosamine supplement at home, you can go and look at the label. But usually for dogs, what is used is actually glucosamine hydrochloride, which is not as bioavailable as the counterpart glucosamine sulfate. Does that make sense so far?
It does. Maybe to precise about the studies, if I'm not mistaken, glucosamine sulfate is one that it has been used in humans and what has been studied in humans, but glucosamine hydrochloride has been used in the studies in dogs, right?
Yeah, that's correct.
Okay.
Listen in vet school, Jeremy. Well done.
Thank you. Christine, maybe to continue, could you tell us what's the recommendation dosing of glucosamine? Generally speaking.
You mean for humans or for dogs, Jeremy?
For dogs.
So that's a very good and interesting question. And it is worth mentioning that there's not a really agreed upon dose that is accepted by everybody in the veterinary community. But if we go off the recommendation of, the study that showed the most, how would you say that, promising maybe results with glucosamine, these are kind of the dose that you would need in theory to potentially help a dog that has like joint issues. But again, it's important to note that there's not a consensus in the veterinary field nor in the human field too. So just want to, put that out as a disclaimer. But so this dosage is what we would recommend based on the study in 2007, that came out. And that seemed to show that glucosamine maybe could help dogs that had joint issues. And so you need basically 1 gram for any dog that is under 44 pounds. And that's a loading dose. And then after loading dose, you can decrease. So, I mean, I'm not going to read, the dosing here, but you can see that you need very high doses. And if you want to follow the guidelines of this study, which again is the only one that had some promising results since the year 2000, you would have to stick with this loading dose followed by a maintenance dose. And they're high. So we're talking about gram of active ingredients, not just milligram. So we're talking about, 1,000 milligram to a gram. And is everybody clear on what loading dose is versus maintenance dose too?
Maybe you can precise like the what's loading and what's the follow-up dose.
So a loading dose means basically when you're starting a dog that didn't have the supplement prior, you're going to want to increase the dose that they have at the beginning in order for it to start showing effect, because the body is going to need a cumulative high amount in order to start responding. And once that amount is hit, which is actually 42 days for glucosamine, so it's very long, you can start decreasing the amount and you go to a maintenance dose, which is the daily long-term use dosing. And again, you can see here with glucosamine that it's 42 days after you start it. And, we'll go over it later, but I think one of the big things to note is that a lot of the supplements with glucosamine don't necessarily recommend even a loading dose. And if they do, it's not always for the 42 days that this study would recommend.
Okay, maybe you can show us some examples, Christine.
Yeah, sure. So, and again, feel free at home to take the supplement you're using and to turn it around and look at the label. And we just took 2 examples of maybe, the most popular ones. One that is very well known in the veterinary space, which is done by Nutramax. It's called Dasaquin. That's the one that most veterinarians are going to recommend. And as you can see, they have a loading dose, and their loading dose is actually appropriate for the duration because it's 4 to 6 weeks. And then so
they're using the study we showed before. That's right?
Yeah. Well, probably, because remember the study was 42 days. Yeah. So that's probably what they're targeting, and that's why they're actually recommending a loading dose. And you see, this is interesting because for this other brand, they're not recommending a loading dose. So for Zesty Paw, which is also using glucosamine, they're actually not recommending a loading dose. So they're not following the recommendation of the study we just saw. You can also see here, as we were mentioning before, that the glucosamine that's used is hydrochloride and it's not sulfate. So that's what we were saying. In humans, it's the sulfate that's used, but in dogs, because it's cheaper to produce, it's usually the hydrochloride. And even in a brand that is recommended by veterinarians, sold through veterinarians, it's still the hydrochloride one that is included in that supplement. I was actually going through a lot of the other brands, and some of them don't even mention which type of glucosamine they're using. So that's why we highlighted them in red. And that's something, again, I'd just be, mindful when you're choosing a supplement. Like, why would you, want to use a supplement that's not actually really being precise in the ingredients they're using. I know, I was concerned when I was seeing this before. So just, maybe look at what you have at home, be curious, and see what you're using.
Yeah, we have a message saying from Leslie saying 600 milligrams in the one she was using for maintenance, and 1,200 milligrams for the loading dose. So I guess this is close to this must be a brand close to Dasoquin, because this is what we have right there, 600 milligrams, and you have to double it for the loading dose for dogs from 30 to 59 pounds. So it must be something similar to Dasoquin, or maybe Dasoquin. Okay, sorry. Do you have?
No. And so, yeah, I mean, in this instance, I guess, Leslie, it also depends the size of your dog. Because again, for example, for a supplement similar to Dasoquin, if you take the recommendations we were reviewing with the study, the dogs that are under 30 pounds or over 44 pounds are actually not getting the right amount. And so it depends. If your dog, is between 30 and 44 pounds, then you might be in that correct range. But again, keep in mind that, glucosamine hydrochloride is not as bioavailable as sulfate. And also, if you're using another brand that doesn't have that loading dose, you might still be under the whole time. So I think that's just worth keeping in mind. If you really want to use a glucosamine supplement, is like, at least make sure that you have a loading dose, and then make sure you're in that, amount you need to help your dog.
Okay. Thank you, Christine. Maybe you were saying like the study you showed was the only one showing good results. Can you talk to us about what the studies have shown for glucosamine? Can you tell us a little bit more about that?
Yeah, so glucosamine has actually been used since probably the 1990s. And so, to be honest, I do admire people that started using glucosamine, because, in that time, like in the 1990s, supplements were very new, and you had to be very open-minded to move away from traditional medicine. And so it's kind of the reason of the popularity of glucosamine these days. But at the time, so when it was started in the 1990s, there wasn't a lot of studies behind it. And so glucosamine was there, and we thought it was a great supplement to use to help with arthritis. But since, there's been much more studies that are been done, because, supplements are growing in popularity, and so people want to know what they're using. And so here you can see by timeline the different studies that have been done. These are, again, all available on PubMed. But if you just look at the conclusion, basically the messaging is that glucosamine hydrochloride with an association of chondroitin is really not effective in helping dogs with arthritis. The one that was done in 2017, it concluded to basically encouraging results, but it still included in the study conclusion that they needed more studies in order to determine whether or not it was really helping dogs with arthritis. And it also just showed that there was improvement in weight bearing at day 70, but it didn't really improve the mobility score or the lameness either. And then the studies done after 2007, they didn't actually show any improvements in helping dogs with arthritis or mobility issues. So all these studies that are done after 2007, just conclude to the same thing, that it's not very effective for dogs, which is very unfortunate.
Okay, so yeah, all these studies are clinical studies, right?
Yeah, they're all clinical studies. Sorry, I forgot to mention that. So clinical studies, it means that basically they're done in a real life setting with patients in the practice, and they're looking at the effect in dogs. So they're not looking at the effect in like a lab or in in a, how do you say that, in a petri dish. Yeah. It's in real life and in dogs.
Yeah, and maybe also most of the time you can precise that it's done on osteoarthritic dogs. The studies are made on this kind of dogs that already has joint issues.
Yeah, the dogs that are included in these studies have joint issues. So they're already it's clinically visible, meaning they have sign of arthritis, that they're uncomfortable or in pain when they're moving, and so that their joints are painful. Okay. And that's the case with the studies, usually the studies done in veterinary medicine for supplements. That's the one you want to look at because they're the one that are applicable in real life.
We have a great question about from Leslie. So why do so many doctors recommend it?
Yeah, so Leslie, I that's a very good question. So, veterinarians, they basically were taught in vet school that glucosamine could maybe help. That was a few years ago. And the more recent ingredients that are coming out have appeared in the year, between 2000 and 2010. So they're newer. But they're also not as popular. So when something is first to market, everybody's going to know about it and everybody's going to start using it. The other thing that's really hard with glucosamine is that there is something that is called the placebo effect. And we were about to talk, we wanted to talk about that a little bit after, but what the placebo effect means in dogs is that actually the owner is giving something to their dog, knowing that it's a supplement and it's supposed to help their pet. When they're doing that, they have the impression that it is helping their dog, even if it's not true. We're getting a lot of question about the placebo effect, and a lot of people are kind of, I think, struggling to understand the concept. We're not saying that the dog thinks you're giving them something and so they're feeling better. It's really the owner. So like I, Christine, am giving something to my dog. I paid for it. I think it's good for them. And therefore, I'm going to see, an improvement, even if it's not actually something. And how do we know that is an actual effect? Is because in studies, you will see when you're measuring results, you will see improvement in dogs that are given a treat. So they're giving something that doesn't contain any active ingredient, and the owner is going to report an improvement. And so it's really hard to distinguish, what actually works from what doesn't work. And that's why, again, when you're thinking about supplements, it's really important to go back to studies. If you go back to the science and the studies, and that's true for human and also for dog arthritis, you're just going to see that, in retrospect, the studies that are being done that are more recent are concluding that glucosamine is probably not the best choice nowadays for your dog. And then the final reason some vets, will recommend glucosamine, even if it doesn't work, is that there are certain relationship between companies and, certain other companies. And that is something too. If you have a relationship, it's sometimes hard to break it. And that is just something to keep in mind. It's, I totally understand as a veterinarian, sometimes it's also good to keep certain relationship, but it's not always the right thing to do. And more vets are actually moving away from glucosamine. And more vets are moving towards newer ingredients. So ask your vet what they think about it. And again, go on the studies on PubMed. It's they're all there. Like what we're showing is available on PubMed. And what is PubMed? PubMed is actually the library. Kind of the resource, the library with all the studies. So you can type these, study names and the scientists that did them, and you'll see their conclusion. They're available for anybody to review.
Okay, thank you.
I hope that helps, Leslie. And if you have more questions, let us know. Sometimes it's, people are slow to change, and that can be a reason as well.
Okay, thank you, Christine. And I think you can share also to us like the meta-analysis that has been made, which is kind of a summary of the studies.
Yeah, the final one that's very impactful, and again, it is also available on PubMed, is a meta-analysis. So what meta-analysis means, it means that it takes all the studies that have been done after a certain date. In this instance, it was all the studies that were done after 2000, which included 72 studies and included 52 articles. You had 9 that were focused on glucosamine and chondroitin, and the conclusion were very clear. They and this one came out in 2023, sorry, so this year. And they recommend that you should no longer use glucosamine or chondroitin sulfate in managing pain or for canine or feline arthritis. So for dogs and cats that have joint issues, their recommendation is to stay away from glucosamine and chondroitin, and that's a new recommendation that just came out this year. If you also look at the guidelines of, you know, the different association too, you're going to see that they agree. So the AHA is the American Animal Hospital Association. So they review the guidelines and the practices, the best practices for veterinarians. And in 2022, they came out with updated guidelines for managing cats and dogs. And you can just go on their website and see it. And they no longer support the Glucosamine and Chondroitin Association to help dogs with joint issues. So things are changing, and, you know, a lot of the studies are just showing that.
Okay, thank you, Christine. And maybe so for people, yeah, I think you answered to the question by answering to Leslie why people do recommend most of the time glucosamine. I think you said it, mostly because it's cheap and mostly because it's because of the habits of people and of veterinarians. And what yourself would you recommend as a vet that has studies, all the studies made on supplements? What would you recommend as a supplement, as an ingredient?
So I had a dog, Pepsi, who suffered from arthritis, and that was 10 years ago. So the reason I'm like saying all this, and I did so much research, and Jeremy, you know this, it's because I had this personal like event happening to me. So my dog growing up, he declared very severe arthritis when I was in vet school. And at the time, supplement wasn't really a thing. So I had to do a lot of research and try to determine what worked. And trust me, I tried glucosamine and chondroitin. Like, I didn't know better at the time, and I didn't know about all the research, but I just tried it, and it just didn't work for him. So I continued doing a lot of research on the different ingredients, and the one at the time that I find that seemed to be more promising, and I also liked it because it was used in human, was called UC2. So it stands for under nature type 2 collagen. And that's the one I ended up using for my dog Pepsi 10 years ago. And since then, there's been even more and more studies that are done on it. And they're starting to show that it seems to be a very robust ingredient, that other studies to date are concluding to a positive outcome and positive conclusion, meaning it does seem to help dogs with joint issues. So this is one of the newer ingredients. And it also has a very interesting mode of action.
Can you explain maybe a little bit of the mode of action? I can see that your design, your scheme.
Yeah, so this is where, you know, this type of slide comes in handy. But basically, just a reminder to everybody, which we didn't really cover, is that glucosamine, the theory behind it when you're giving it to a dog, is that because it's contained in the cartilage of the joints, you're supposed to be bringing the building blocks of the cartilage. So the idea with glucosamine is that if your dog has joint issues, the cartilage is going to be damaged, and so you're going to give your dog glucosamine, and in theory, the body is going to use glucosamine to repair the cartilage. We're not 100% sure that it actually works that way, but what we're missing here is especially decreasing the inflammation, which is what leads to ongoing joint issues and joint destruction. And so with UC2, the reason I really like it is that it acts through a specific mode of action, which is called oral tolerance. And what it does is that when you give UC2 to your dog or to a human, you're training the immune system to recognize when the joint is being damaged. And it's not only going to help heal the cartilage, it's also going to decrease inflammation at the joint level. And it does that through oral tolerance, where basically UC2 is training the immune system to recognize when a joint is being destroyed, and to stop destroying it. So that's the really cool part about this active ingredient, is that not only is it giving the building blocks, but it's also preventing inflammation at the joint level. So what it allows it to have a healthier environment in the joint. And so the joint can repair, and basically it's going to slow down the progression of joint disease.
And compared to glucosamine, can you tell us, because the mode of action looks really interesting, but can you tell us how the studies, what say the studies about the UC2 compared to glucosamine?
You like your studies, Jeremy? Huh?
Yeah, I do like studies. I mean, they're objective, so yeah, I do like them.
I can't bring anything past you. So yeah, the studies that I was, referencing, again, they're public, clinical, meaning they're done in dogs that have arthritis. So it's in real life setting, and there's been a few that have been done. And here you have 1, 2, 3, 4, 5, 6. The 6 like most important and impactful one, but there's more. There's about 11 these days, and they all conclude to a positive effect of UC2 on improving comfort of dogs with joint issues.
So what you have here is the conclusion on the right. Are there any, you said just before that UC2 was superior to glucosamine. Are there studies that have been done UC2 against glucosamine?
You should do studies, Jeremy. There has been studies that have been done confronting glucosamine, UC2, glucosamine and chondroitin, and placebo, because again, you do want to control with placebo, because when you're giving something to your dog that doesn't have an active ingredient, you still see improvements. That's actually the study Gupta and Au that you see there, 2012. Where basically it looked at the effect of UC2, glucosamine and chondroitin, placebo, and then the association of glucosamine, chondroitin, and UC2. And that study is very interesting because it measures the results in an objective way, meaning those scientists used what we call a force plate. So it's a very long scale that is, maybe 6 foot long, where you have a lot of sensors at the bottom. And what it's going to do is it's going to measure the pressure that dogs are putting on their joints as they're walking. And so when a dog is lame or is in pain, they're not going to be able to put as much pressure on their joints just because of the pain. Like, when you're limping, you're really trying to put as much pressure as you can on your good leg and not on your bad leg. And so a dog is going to do the same. So this is a machine that is measuring how much you're helping the dog, reducing their pain so that they can put more pressure on their joints. And so that study showed that the only ingredient that had an objective result with this force plate was UC2, and that glucosamine and chondroitin did not work, and placebo did not work either. So that's the study that, confronted glucosamine and chondroitin and then UC2. You also have another cool study that is done on UC2 and on an NSAID, which is a non-steroidal drug. And basically, it looked at the effect of non-steroidal drugs in improving the comfort of dogs with arthritis compared to UC2. That is the one from Stabile in 2019. And that one showed that it was also, so UC2 was as effective as that non-steroidal inflammatory drug in helping improve comfort in dogs with mild to moderate arthritis. And in the more severe cases, you need to use a stronger drug potentially, or you need to use a more comprehensive approach to pain management just because it's more severe. So a supplement is not a drug, and therefore you're probably going to need to add something. But it is pretty, interesting to see that for mild to moderate, it really helps the dog feel better, basically.
Yeah, and what I really like about your slide is that show also that every studies made on UC2 are pretty modern, pretty recent, with 3 studies made in the last 4 years, 2019, 2022, and 2 in 2022. So I guess it's like pretty, with a modern standards and pretty serious.
Yeah, and again, when I started, that's very true. And when I started looking for it 10 years ago, you only had a few studies. As you can see, it was like in 2010. So you had like 2 2-3 studies that were out there, but now there's more. And every year there's a new one that's coming out. And that doesn't include the studies done on humans, on horses, and on cats too, and also on rodents. So there's a lot more studies that are out there. And UC2 seems to be across the board a very solid ingredient for managing joint pain.
So can you tell us, maybe this is why you decided to use UC2? Can you tell us more about the story behind UC2 and your usage of UC2 and how you come up with this with the company you made?
So I basically, we can go to this slide, I guess, because like that you can see Chi-Chi, who made me very happy. But so what happened is when I started looking at ways to help Pepsi, again, 12 years ago, even more, 13 years ago now, time goes by really fast. I was struggling to find something that would work. And when I tried glucosamine, it wasn't for him. I could tell it just wasn't helping him. What did help was UC2. And then, you know, because he had very actually severe arthritis, which we were talking about earlier, meaning he could barely walk, he was really painful, we needed to do more for him. And so that's when we added omega-3s. And we also ended up adding curcumin later because of the results in humans. And so when I decided to create a joint supplement, I wanted to make sure I included these ingredients. I reviewed all the studies, you know, that had been done between 2010 and 2022, because that's when we came out with this supplement. And they confirmed that UC2 was a very strong candidate, along with omega-3s, and that curcumin had very encouraging studies as well. The other thing that most supplements, unfortunately, are going to have, and that's, you know, separate from the active ingredient, but in my opinion, it's also important, and that's why I wanted to create Jope, is just the list of inactive ingredients. So when I was looking through other supplement for my dog, Pepsi, one of the things that really frustrated me was the fact that the ingredients were not organic, and usually they were very long. Like long lists. So there was like maybe 20 inactive ingredient, half of them I can understand. And I didn't really understand, you know, why I want to give this to my dog Pepsi, who wasn't doing that great already. Like, why would I want to add something in his body that wasn't, you know, great? And so that's why I decided to create Jope, which actually includes organic ingredient, a limited amount of ingredient, and then the 3 active ingredients that I had used for Pepsi. And we're getting very good results so far. We have some vets using it, a lot of actually, yeah, and people are just pretty excited. It's really heartwarming when you see results that it's helping other dogs and not just Pepsi. So we love it when we have veterinarians telling us that it's helping their patients, and we love it when pet owners tell us that it's helping their dogs.
Thank you for this complete answers and for the presentation of your product. We have a question from Leslie. I mean, it's not a question, it's more a statement, but maybe you can comment about it, because she's saying that I've read good things about green lipid mussels, and so she's trying it with her dogs. I guess so, Leslie. So maybe you can give your insight about green lipid mussel.
Yes, and I love green lip mussels, so that is definitely, you know, a very strong ingredient too, and it was on my radar when I decided I was going to create Jope. The thing with green lip mussel is that it is an oil. So green lip mussel is actually an oil that is extracted from a mussel that has green lip, therefore the name. So it does come also from seafood, and the purest form is actually an oil. And I from the research that we did and from all the studies that are published, the best form of green lip mussel is actually in this liquid oil format, right? So the best way to give this ingredient to your dog is actually through a liquid form. But when I wanted to create a joint supplement, I wanted it to be a chew. The reason being, I wanted to be able to have like a nice experience with my dog. Like Pepsi, when I gave him the supplements, I actually had to give him pills of everything. So I was like smashing the pills, mixing them, and giving it to him because I didn't have an actual all-in-one combination. And I would have liked at the time to have like, you know, a nice relationship with Pepsi and be able to give something like a treat that was also helping him, versus just mixing a bunch of different things. And so when thinking about the product I wanted to bring to market and to make available to people, I didn't want to include like a pill form. So I didn't want to include, you know, pure liquid in a capsule. I really want to put it in a chew. And for that reason, it's not an ingredient that can actually be included in a chew at the appropriate therapeutic dose. But UC2, curcumin, and some omega-3s could be put together to create Jope. And Leslie, it's actually, you can actually use green lip mussel with UC2. And the reason for that is that green lip mussel is actually going to help modulate the one arm of the inflammatory cascade, which is called the lipoxygenase route, versus UC2 is going to help modulate another arm of the inflammatory cascade. And it's actually through oral tolerance, and it's targeting different, basically, cells and a different mechanism of action. So they're very complementary, and you could actually use them together if that was something you were interested in. But it is a great ingredient, and we just elected not to use it for Jope. But it doesn't mean that, you know, it's not another very good supplement. And the studies are also very positive. So okay. I hope that helps, Leslie. It wasn't for our product, but it is certainly another very good product too. And they can be used together, which is nice.
She's answering that she's not using the oil form, so how to know what is right to use. Good to know. You can use with Jope. Thank you, Leslie, for your comment. And does anyone have any other question before we let Dr. Christine go?
I'm closing my beautiful presentation.
Yeah, I don't see any other question, Christine. I guess we went a little bit further than we wanted to be at the beginning. It's been 40 minutes we are together, so that was great. But maybe it's time for everyone to go back to their activities. So, Christine, thank you very much for this webinar, and maybe you can conclude by a few words.
Yeah, well, thanks everybody who joined it. Sorry, I'm losing my English. I'm gonna start speaking French now. But if you have any questions, you can go on our website. It's petjope.com. And any of the emails that you would send, contact@petjope.com, actually goes straight to me. So you don't hesitate to, you know, give feedback, comment. If you have any questions about your supplement, the one you're using, and you just want to brainstorm some ideas, feel free to reach out. If you want to try Jope, we have a first-time offer where you get 30% off. Email me if you didn't get the code, but otherwise it's a first-time Jope. And yeah, just reach out. Thanks everybody for joining, and we appreciate you staying with us to go a little bit over. And Jeremy, hope you have a good night.
Thank you very much, Christine. And have a good day, everyone. And thank you for joining. Bye-bye.
Thanks for joining. Appreciate it.